Welcome to the second part of our Alice in Focus series. I'm Stephanie Hoops, National Director of United for Alice, a driver of research and innovation around financial hardship. ALICE stands for Asset Limited, Income Constrained, Employed. These workers and families are essential parts of our community, yet struggle paycheck to paycheck. And because they earn above the federal poverty level, they don't qualify for many types of assistance. Our focus today is on ALICE people with disabilities. I'll share top-level findings from our research and introduce you to a few of our National Leadership Committee members, advocates, and allies, including those with lived experience. You'll find that their passion and example will inspire you to dig into the data, incorporate it into your work, and use this research to improve the lives of ALICE, especially those with disabilities. Our research finds that traditional measures of poverty have severely undercounted the number of people with disabilities nationwide who experience financial hardship. The numbers tell a familiar but uncomfortable story. According to the federal poverty level, almost 18% of people with disabilities in the U.S. were struggling in 2019, just before the pandemic hit. But the ALICE measures show another 33.5% could not afford a basic household budget of housing, childcare, food, transportation, healthcare, a smartphone, and taxes, which means that combined, almost 21 million people, or more than half of people with disabilities in the U.S. were below the ALICE threshold, living in households that were priced out of survival. This is a finding that we have seen at the household level, and it is now further supported by our analysis here of people within these households. Over the past 10 years, we at United for Alice have explored many dimensions of ALICE workers and families, including race, ethnicity, gender, education, and work status. The gap in financial hardship by disability status is one of the biggest that we've seen. 51% of people with disabilities were struggling compared to 36% of people without disabilities. Our research also confirmed anecdotally what we have all known. People with disabilities have a much harder time securing a job than people without disabilities. The impact is staggering. People with disabilities were more than twice as likely to be unemployed, which means actively looking for work, and 3 times as likely to be out of the labor force altogether. The challenges persisted for those working. Even for people with disabilities who worked full-time, more than 1 in 4 were below the ALICE threshold. Another set of important findings was around housing instability, which we know has a profound impact on overall well-being. A lack of stable housing puts people with disabilities at risk for poor physical and mental health, and may even impact their ability to live independently in the community. We found that people with disabilities lived in both renter and owner households. Those in renter households were more likely to be below the ALICE threshold and to be housing burdened, paying more than 35% of income on housing. To bring this data to life, we turn to Tyler Urias from the Disability Network in Southwest Michigan.
I am Alice. My name is Tyler Urias. I am a white male with blonde hair, blue eyes, and I'm wearing a gray shirt. I live with my sister, her 3 children, and my mother. I have used a wheelchair my entire life and use hearing aids. I do live in a pretty fairly sized big city. It's not the biggest, but it's not the smallest either. I have always wanted to be like my father and provide a home for his family. And after he passed away, we lost the house that we did have. So it was really important to me that I find a house for me and my family. It became very clear to me quickly that all of the apartments, duplexes, townhouses, and even single-family homes that I had looked at did not offer any accessibility and were never even offering to retrofit anything to accommodate. A few years later, I got a full-time position at a well-paying job, and it was finally more financially secure than I had ever felt. But I still couldn't find housing that would have the features and needs that I would want for total independent living. So when I had tried finding housing for me and my family, I encountered several barriers, some of which are no availability for houses with universal design in mind in the areas that we were looking at, or really in any of the areas that we tried to expand outward to. And due to the lack of accessible housing options, I've had to sacrifice either having more independence for something that should be more widely accessible to reflect the communities that it impacts. Even now, I live in a 3-bedroom, single wide trailer. It was not fitted to be accessible for any disability. And when I have requested accommodations, I've had to divulge personal medical information to people that I hardly know for access to basic accommodations for total independence. I feel like I am made to choose either between living in a home that I would have limited access to or be individually moved into a community-based living facility away from my friends and family. And I feel like this is largely in part due to the inaccessibility that permeates larger cities and cities all over the world, much like the one I live in of Hastings. Thank you.
Tyler lives in Hastings, Michigan, but Alice lives in all states in the U.S. Our research shows that Tyler's challenges of finding affordable, accessible housing exist across the country. And while Alice people with disabilities span all categories of age, gender, and race and ethnicity, we found that certain demographic groups, including those that face systemic racism and sexism, have higher rates of disability. This intersectionality also increases rates of financial hardship, especially for people with disabilities who are female, Black, Indigenous, and other people of color, and/or born outside of the U.S., as well as for groups like LGBTQ individuals who are not fully represented in the American Community Survey data that we rely upon. We invite you to read our national and state level briefs to better understand the challenges that this population faces, and we encourage you to act upon this data. Our leadership committee member, Denise Nix Thompson, the executive director from Equally Alive, makes the case for using this data to ensure that the needs of all Americans are met.
What the ALICE briefing report does is provide an opportunity for us to have real data that can be shared with elected officials, policymakers, funders, parents, and others to ensure that they understand that there is a high cost and unfortunately many people with disabilities face poverty, they face other barriers to social determinants of health, food insecurity, as well as housing issues. And this report really lays out in quite detail the challenges that our population faces. And it is a document well worth reading and hoping acting upon to provide better care, reduce costs overall by providing more wellness strategies, and to ensure that we are not left out of the needs of Americans. Thank you.
Denise's work advocating for people with intellectual and developmental disabilities and medical complexity reminds us about the daily physical and mental challenges many people with disabilities face. Whether a disability is ambulatory, cognitive, hearing, or vision, people with disabilities often struggle to maneuver in an able-biased culture. Layer the pandemic on top of that, and it's striking, but not shocking, that during the pandemic, 40% of people with disabilities below the ALICE threshold reported feeling anxious nearly every day. So what can we do with this research? Leadership Committee member Michael John Carley from NYU's Connections Program for Global Students with Autism highlights the data that jumps out to him and how it can be used.
I'm Michael John Carley, and for those of you who don't know me, I am one of these very lucky people with autism who also gets to work wearing many different hats in the autism, neurodiversity, and disability worlds. And I'm speaking to you through one of those hats, and that is, especially at this particular juncture in time, as a very proud member of the ALICE Leadership Committee for People with Disabilities. We now finally have research. We have great research now, and we have lots of great research for all of us who are working so hard to better the lives of people with disabilities to be able to use to further our goals. it's incredible research. It doesn't even just focus necessarily on disability and economics. There's so much intersectional potential in the work that the Alice Committee did that disperses issues through ideas of race, through educational attainment, age, living arrangements. And it does so breaking all of these teaching moments into state by state explorations that tell really unique regional stories. This is data that I hope you all and we all will be using for decades in our work to inform policies, write harder hitting journalistic stories, to lobby for increased services, and to lobby for better delivered services.
Michael John's work at NYU is much needed. Our research shows that people with disabilities were less likely to go on to higher education than people without disabilities. And even where they did, they were more likely to live below the ALICE threshold. Notably, 36% of adults with disabilities with an associate or bachelor's degree were below the ALICE threshold, compared to only 19% of their peers without disabilities. Leatrice Fullerton from the Disability Network shares her story.
Hello, my name is Leatrice Fullerton, and my pronouns are she, her, and hers. I am the Advocacy and Community Education Director with Disability Network, Southwest Michigan. But that wasn't always the case. As a result of being born with congenital glaucoma, I am blind. After obtaining a master's degree from Western Michigan University in the field of social work, it was 3 years of actively looking for employment before I was offered my first part-time job in the field.
These findings may seem overwhelming: the number of people, the plethora of barriers, and the compounding impact. How can you even get started? Zane Landon, a member of the Young Adult Leadership Council at the National Center for Learning Disabilities, offers some advice about where to begin and how to be an ally for people with disabilities, especially those who are ALICE.
How can I support you? What can I do to show up for you? And I think that could be the first step right now during Disability Pride Month. There's so many resources coming out right now. And I think that, that's where you can start, by just kind of educating yourself and immersing yourself in the, space. And also there are literally hundreds of organizations that focus on disability, and they always need volunteers. That is something that I realized, a lot of them are nonprofits, and a lot of them could use your support. So if you want to just reach out to an organization and volunteer and meet, people who work there, I think that's another good first step too, because you're actually being tasked with stuff that you can work on that will actually make a difference. So I'd say that's another thing you can do as well. And also, if you feel alone as a person with disability wanting to do advocacy, or just you don't know anyone, I would say, again, being involved in an organization is a good first step, because you're actually going to be in a space where there's people who are passionate about what you are passionate about, and they also care about your community, or the community you want to start advocating for. So that's kind of like what I would consider how you could possibly start.
As Zane emphasizes the importance of educating and immersing yourself, we invite you to visit our website, unitedforalice.org, where you can download the national and state research briefs and dig into our interactive dashboard. There's a wide range of indicators, demographics, resources at the state and local level. They're presented through graphs, maps, tables, and the site is interactive and easy to use. And for those of you who might benefit from additional accessibility, look for our little man icon on the lower left of the web page for our AI-powered accessibility widget. So thanks for joining us today. We look forward to working with you to shine a light on ALICE and to highlight the additional barriers that people with disabilities face in achieving financial stability. We know that our communities, our economy, and our families are stronger when ALICE does better.